right, welcome everyone. Thank you so much for being here. We will go ahead and get started. For those of you who want to continue in English, please stay put.
Las personas que deseen escuchar la versión en español, por favor elegir el idioma oprimiendo el botón en forma de círculo donde dice español en la parte inferior de la pantalla. Gracias.
Thank you, Christina. And again, welcome and good afternoon to our live attendees today. We are grateful you are here to engage in our webinar, Comprehensive Behavioral Health Model, Integrating Behavioral Health Services in Boston Public Schools. I am Molly Streer, and I am one of the hosts of our webinar today. I use the pronouns she, her, and I am a white cisgender female in my early 40s with pulled back dark brown hair. I am wearing a black top and my background is blurry. I am the school counseling program coordinator in the Department of Counseling here at San Francisco State, and I am one of the co-investigators for this project. I am working alongside the project's primary investigator, Dr. Julie Chronister, who is the coordinator of our clinical mental health counseling program, and my co-investigator, Dr. Tiffany O'Shaughnessy, who is the coordinator of our marriage and family therapy program. I would like to introduce and thank our graduate assistant, Christina Cabiles, who is supporting our technical aspects of our webinar today. And I would also like to thank our other project assistants, Chinui Igwe and Shirley Sang, for their ongoing support. I would like to acknowledge that SF State's campuses in San Francisco sit on the ancestral homeland of the Ramaytush Ohlone. We further acknowledge that we work on the ancestral lands and waters of many other Indigenous peoples and nations in our field work in the Bay Area and around the world. We are committed to ensuring this webinar is accessible to our audiences. Closed captioning is available in the closed captioning option at the bottom of your Zoom screen. If at any time your access needs are not met or become not met during the webinar, please send a chat directly to a host or a co-host. Access is always a work in progress, so we appreciate your comments, feedback, and support. This is our fourth webinar of the year, sponsored by our Equity and Justice-focused Integrated Behavioral Health Counselor Training Project, which is fully funded by the Department of Health and Human Services, Health Resources and Services Administration, as part of an award totaling $1.9 million. A couple of additional things before we begin. If you're one of our HRSA stipend recipients or are interested in receiving continuing education units for your attendance today, please pay close attention to the announcements provided in the chat for sign-in and evaluation links. As a reminder, this is a live recorded Zoom webinar. Therefore, the audience is not visible and the audience cannot turn on their video or audio. The chat function is available for comments, sharing of resources, supportive emojis. To ask the presenters a specific question, please post your questions in the Q&A function. Q&A will occur during the last 5 to 10 minutes of our webinar today. So please post your questions in Q&A as they emerge, and the presenters will answer questions at the end of the webinar. Our presenters are joining us today on behalf of their leadership providing integrated behavioral health services for youth in Boston Public Schools. We're very excited to welcome Dr. Andrea Amador and Dr. Yvonne Barrero, as they are truly leaders in this work. Dr. Amador is the Senior Director of Behavioral Health Services for the Boston Public Schools. Andrea has dedicated her career to urban school psychology and began her career as a school psychologist before becoming an administrator. Andrea, along with her staff and partners, have developed the Comprehensive Behavioral Health Model, which is a multi-tiered system of supports designed to support the behavioral health needs of students across a continuum of prevention, early intervention, and intensive services. Andrea serves as the National Association of School Psychologists delegate for the Massachusetts School Psychology Association and the NASP delegate representative for the Northeast. She is also the coordinator of the NASP Supervision Interest Group and the immediate past chair of the NASP Practice Model Committee. Dr. Amador is an adjunct faculty member at Northeastern University. Dr. Barrero is the Assistant Director of the Office of Behavioral Health of Boston Public Schools, where she directly supervises school psychologists. She also works with teachers, special education, and English language staff to support their work with English learners and special education students. As a bilingual school psychologist, she has gained a vast experience in working with bilingual students in Puerto Rico and Massachusetts. She has worked for Boston and Newton Public Schools, and during the time in Newton, she developed programs for students learning English and students with disabilities whose native language was Spanish. She has supervised graduate level students who are completing their practicum and internship experiences for over 20 years. She is also a member of the English Learners and Students with Disabilities Task Force of the Boston Public School Committee and the English Learners Advisory Board for the Department of Education. She currently teaches a graduate level course at La Salle University in the Education Department. It is with great gratitude that I will now pass it to our presenters.
Thanks so much. We're very honored to be here today. Yvonne and I have a very short time to tell you about the great work happening in behavioral health in Boston Public Schools. And then hopefully save some time for your questions. So please use that question feature to share any questions you have so we can make this really meaningful to you. So we'll just start with a brief overview of our department. We have been very intentional in our district to increase the diversity of our behavioral health staff. So Yvonne and I have worked with school psychologists to develop an internship and hire a very diverse, culturally and linguistically diverse staff. And that means our staff can provide a range of behavioral health services to all students in BPS. A couple of key features that our staff do is work to bring multi-tiered systems of support to all schools in the Boston Public Schools. We work with community partners and teachers to create safe and supportive school environments where students' both behavioral and academic needs are met. Our team also provides a range of direct behavioral health services to students, including counseling, crisis support, psychological evaluations, as well as consultation to teachers and families. And we accomplish all of our work through school social workers and school counselors and community mental health partners. So effective behavioral health in schools means we work across role types to really come together and meet the needs of kids. And so we've spent a great deal of time, Yvonne and I, creating really important partnerships, both within other departments within Boston Public Schools, but also with a range of community partners in our local community, as well as state and national resources to support our kids.
So I think one of our biggest assets is being able to collaborate with other departments. And so if you look at this particular graphic here, our beacon of work, we collaborate with all sorts of departments like counselors, like social workers, right? And so those are the essential components of our work. And it's really prevention. We are culturally responsive in everything we do. We use culturally responsive PBIS, and that's the groundwork at the instructional level. We do social emotional learning. We do responsive work with racial equity, work with social workers, with even our nurses are trained, right? So at every single department, we try to collaborate to provide high quality professional learning and services to children. We have a safe and supportive school mentality, universal social emotional learning, and we do universal screening in order to really understand what our students need from third grade all the way up to high school. We believe in early interventions. So all of our psychologists work close with the teams at their schools to provide these interventions and really address them before they become problematic and end up in special education. So that preventive work is critical at the tier 1 levels. We move up into the tier 2 levels with the teams at the school, like Andrea was saying, in the multi-tiered levels of support. And those behavioral interventions require the guidance counselors and the social workers, and even our outside supports from our community partners. The intensive services at the tier 3 level, like crisis intervention or individual counseling that do not have to be in an IEP, right, an individualized education plan, are offered many times by our community partners. So before we get into special education, we try to use everything we have available to us. We do lots of functional behavior analysis, and we develop behavior plans before we get to special education, and trying to leave special education services as our last resort. We do use our comprehensive behavioral model as the basis for everything we do. And as you can see at the beacon of our lighthouse, we also, of course, being in Boston, we have great hospitals. We use our community partners like Children's Hospital, Mass General Hospital, to really collaborate with them. They have great clinics that do also assessments for us and help us really develop this community partnership and really collaborate and do wraparound services for our children. Our CBHM model right now is in about 76 to 80 schools, and that really gives us a chance to implement programs across the district. The team facilitation and coordination is the critical piece of our work, and how we collaborate with principals, school leaders, even at central office, to really get this work off the ground.
So Yvonne gave you a very nice overview of how busy our school psychologists are and what they're doing every day. But we kind of like to share this data to give you a little deeper dive into really what it takes to provide comprehensive behavioral health services in schools by the school staff. And we will continue to acknowledge the important role of partners, and together we're meeting the needs. But this shows you some monthly data about the different types of activities school psychologists and social workers are doing in our district. This data is specific to school psychologists. You'll see that the green box at the top are tier 1 prevention services. So in the past, before we started this model, all school psychologists primarily did was psychological evaluations for special ed eligibility determination, and a tiny bit of counseling and some crisis. So three kind of primary roles. But as we develop this comprehensive behavioral health model in partnership with Children's Hospital in UMass, we recognize that in order to ensure a continuum of behavioral health services to students, we as school psychologists needed to expand our role. And that also applies to social workers and school counselors and community partners. We all needed to expand our role to provide this continuum of prevention and promotion of positive behavioral health, as well as early identification and early access to behavioral health supports. And then in red, the more traditional tier 3 intensive services. We can no longer wait until kids end up in the red box until tier 3. We as educational institutions in partnership with community services, we have to start in the green box. We have to start with that prevention and promotion. So you see in that box, school psychologists are doing loads of professional development. They're working with their school-based teams and principals and partners to provide professional development about what is behavioral health, what are interventions you can do, how do you create trauma-sensitive classrooms, how do you provide supports in culturally responsive ways. That's all of the work happening in Tier 1. And they're doing a lot of direct service work in Tier 1 by facilitating teams like climate teams to look at what the climate in the building is, instructional leadership teams to look at the quality of instruction in the building. And so that's what you see represented in that green box, that prevention and promotion work. In the yellow box, you start to see those Tier 2 services for at-risk students. So these students may or may not have an IEP, they may or may not have a mental health diagnosis, but they have there's been some indicator, most often from our universal behavioral health screening, which we'll talk about, that there are some red flags, some warning, some additional supports needed. And that's what you're seeing in Tier 2, where they're starting to attend what we call student support meetings and looking at individual children's needs and the risk levels they have, and putting into place consultations, groups, maybe Tier 2 lunch bunch groups, trauma support groups, girls groups, anxiety groups, classroom behavior management plans, to start to say, we see some warning flags and how can we jump in early and support a kid. And then in red, in the Tier 3 box, you're seeing a whole range of traditional school-based mental health services, including crisis, individual student crisis, school-based crisis, suicide and threat assessments, psychological assessments for special education eligibility, individual counseling, group counseling on an IEP. And this really is just to give you a sense of all the different elements it takes to provide that continuum of behavioral health. And to do this, we like to say we have the best school psychologists and social workers in the world. And so Yvonne's going to talk to you a little bit about our staffing. They are the key to everything we do.
Yes. How do we do this, right? We have this tremendous team of people. Here's just a group of them, but this is how we do this, right? Andrea and I have the pleasure of being their supervisors, and in our office staff over here on the left, we have 2 principal clerical staff members, Mary and MC, who just joined us about a month ago. And then we have a CBHM coach, Mary Cohen. She leads our CBHM movement. She is the one that trains people on how to do MTSS and works with schools and helps them set up the MTSS model and our CBHM model. Then Whitney is our research and data coordinator, and she helps us kind of keep our data and gather our research, and she helps us to write our information and keeps us, writes our annual report, which we publish and we're very proud of. So she also helps us with our special education data as well. So, and all our spreadsheets and all of that technology piece. So we have 106 school psychologists, of which we have 30 bilingual, and here are the languages that they speak, which we are also very, very proud of. In the state, we are the district that has the most varied bilingual speakers. So this is of course, kudos to Andrea, who's been very involved in hiring, very focused on hiring bilingual speakers. Boston is a unique city because of our hospitals. We get a lot of families that come here for services. And so they also, if they come for services, they come for education as well. So we have all of these unique situations where many of these students come for services and they're here for many, many months. And so we have to service them in our public schools. So right now, of course, our biggest language is Spanish. And about 73 of our English learners are Spanish speakers. So we have 15 school psychologists that speak Spanish. But Haitian Creole is next in line, and our Chinese languages are right there. Cape Verdean Creole is another big language. So we're really have a lot of languages. We have 9 major languages in Boston, but we have a variety of languages that are represented in our city. Andrea?
So what are these incredible, diverse and knowledgeable school psychs doing? One thing that we realized very quickly is if a mental health staff member, so we're speaking of school psychs, but please know this applies to social workers as well and counselors. If they're only part-time in a building, as we've described to you, there's tier 1 prevention work, there's tier 2 work, and there's tier 3 work. They can't do that all if they're only in the building 1 or 2 days a week. Yvonne and I will tell you the story that when we were both school psychologists before we became administrators, I used to have 5 schools. Yvonne had 20 schools at one point as a bilingual school psychologist. There's no way Yvonne or I in that many schools could have done all the activities that you see here. When we were part-time in a school, we weren't even 0.4. We weren't even 2 days a week. We were 1 day a week, and every day was a different school. For Yvonne, every day was 2 or 3 different schools. There's no way we could have provided a continuum of behavioral health services. So what this slide really shows you are some of those specific things we've mentioned to you that school psychs do: universal screening, group counseling, training, SST, direct services. Really, when you don't have someone full-time, they cannot do all of these activities. So one of the first things, if you move on, Yvonne, that we have advocated to do, we increase our role and we build our skills to develop this continuum, but then we've really fought hard to have more school psychologists, more social workers, and more mental health partners, so that every school has a full-time school psychologist, a full-time social worker, and a full-time mental health partner. That's our life goal, and then Yvonne and I are going to retire. But we're not quite there yet, but the good news is we're a lot closer. When Yvonne and I first started, we had 48 school psychologists, 6 social workers, and mental health partners in 40 schools. As of today, we're super proud to say we've gone from 48 school psychologists to 106 school psychologists. We started with 10 district social workers. We now have 157 social workers, and that number actually has continued to increase this year. We started with mental health partners in 40 schools. We have 100 schools with mental health partners. So we're getting there. That's a great improvement through a lot of advocacy, but also showing the importance of behavioral health. Because when someone is full-time in a building, when a school psych is full-time in a building, look at all the work they can do. They can do that tier 1 prevention work that we've been talking about. They can start to see targeted students with early warning signs of behavioral health needs. And they can do those intensive services that are either required by law or by necessity. And so one of the key components to what we're talking about with you today is building a strong and cohesive internal team that has a clear system and integrated partnerships with external. And together that workforce can meet the needs of students. And Yvonne's going to give you some specifics about how we're different tools and resources we're using to support all kids and our ELL kids.
And I know that the person who's doing the interpretation, if we're talking too fast, please let us know. I can't see the chat, so please send us a smoke signal if we're going too fast. We want to cover everything. So there's a lot of work to be done. I am in charge of the special education side of things, and I work with the school psychologist, the Office of English Learners, and special education, right? So that's kind of my wheelhouse. And here are 4 areas that I wanted to bring to you that I think facilitate the work for our students and the collaboration that we do with not just special education, but academics and the social emotional learning department. And, just thinking about the work we do with students, I think we're out of the pandemic, right? And we hope we're out of the pandemic. And those were years that were very critical for us because we had to rethink learning. We had to rethink teaching, right? All of a sudden, I remember Andrea saying to us, look at your office and think, what do you need to do your job at home, right? And it was like a moment where we had to think, oh, okay, I need my computer, I need paper to print, what else do you need, right? And so taking home what you needed to do your work, but then what do we need so the students could learn at home, right? And so we had to reshift our thinking, change our mindset, and really reestablish learning. And so right here, I want to talk about a couple of things that have also changed the way we do assessments and the way we do special education. So Q Interactive is the way that assessments have changed. We do testing using an iPad. So before, Andrea and I used to carry around all these big boxes of kits that had all the things we needed to do assessments, whether academic or cognitive assessments. And here, at least here in Boston, the city is awful for parking. And so we had to carry all of these boxes throughout from one building to another, trying to get these kids tested. And then we got to the school and realized we brought the wrong kit, right? Well, now through Q Interactive, we have everything on a set of iPads. And it's great because we can manage it really well. And all of a sudden I realized, oh, I want to do a memory test. Well, then I go on my iPad and change it and add it or take away. So this really has facilitated for our psychologists the way we do assessments. We have it at our fingertips. It is scored easily, and it really makes my testing so much more focused, right? So Q Interactive, that's from Pearson, that has a lot of tests. I don't work for them, but it really is a great tool to really make it more focused, right? So that's Q Interactive. Goldbook is also an app that you can look for materials, write goals, develop lessons it's an app. So you go in and say, I want to create a lesson on a biology lesson for students in the 4th grade on whatever, right? And so you write it in, and Goldbook will write your lesson for you on different reading levels, and you print out everything, the materials, the quizzes, the homework, and then you can come back to Goldbook and say, you know, I had 3 or 4 students who really didn't get the lesson or had trouble, and it will adjust your lesson to meet the needs of those particular students. If a group of students had trouble and they needed some adjustment, and you needed to scaffold the lesson, Goldbook will do that for you. It's such a good tool. If you're writing an individualized education plan, it will write the goals for you, right? If you need to break it down and break it down depending on, the student's reading level, it will do that for you. It's such a great tool, right? But what happens if I have English learners and they're at different developmental stages learning their English? Then I came across another tool that's called Nearpod. I am totally in love with Nearpod. Again, I don't work with these people, but I wanted to share the tools that really have worked for us here in Boston. So Nearpod is also on the iPads. And what is great about Nearpod is, as a teacher, I can have my lesson on Nearpod, but I can have it in 20 different languages. The same lesson in 20 different languages, and all of my kids in my classroom can have the same lesson in their languages. So I can be speaking in English, my kids can be having it in German, in Spanish, in Arabic, same lesson. And we can all be doing the lesson together. As a teacher, I can follow who is doing what, so I can be adjusting my lesson, right? And they're getting the lesson in their language. And nobody's being pulled out of my class. So nobody's being isolated. It's culturally supporting my students because we're all in the same room. It's in their language. I can send this lesson home. If mom and dad don't speak English, they get to see the lesson that I'm doing in their language. It is so inclusive. It is just amazing what this Nearpod can do. I'll give you this example. When the earthquake hit Haiti, lots of Haitians moved to Miami. So what could they do? How could they address this huge problem of having families moved and they couldn't speak English, and the school district really couldn't manage it? So they used Nearpod. They had all their lessons incorporated in the Nearpod program. And so everybody uses Nearpod in Broward County in Miami. And so that's how they manage that situation. And now they use it for everything, right? So Nearpod has really helped us do education in a variety of languages. Another way we use in Boston, we use Nearpod is, for example, a speech and language therapist is doing an assessment, and she finds that she needs to do an articulation lesson, but the student that she needs to work with speaks a language that she doesn't speak. So she then has the lesson or the therapy translated in Cantonese, for example. So she can then provide therapy in Cantonese because it's done on Nearpod. So she has it in English and she can provide it in Cantonese. She can then share it across the district with other speech and language therapists. So the use of Nearpod, because it is a multilingual tool, it is amazing. So my work with the multilingual learners across the district has also been critical for us, because we've been able to write guidelines on how we assess multilingual learners and write guidance on when you test them, because sometimes being bilingual is not a disability, and monolingualism can be cured, right? Being able to speak 2 languages is a superpower. It just takes a little bit of time. We need to understand that students that have to deal with 2 languages, it's really something that the brain has to really manage. So we really foster being bilingual as a superpower. So we really want to become a dual language district. We right now have 5 dual language schools here in Boston, and we are working, one of them is a Haitian Creole language, dual language school, and we're getting ready to open one in Cantonese and one in Vietnamese. Those will be the ones coming up pretty soon. So we're really proud of that. I'm very passionate about English learners, and I can talk about that for the rest of the night. So we'll go on. But how do we continue to work around that? Andrea has really worked so much with creating work with university partners. So I'll let her talk a little bit about that.
Thank you, Yvonne. So one of the things that we've mentioned over and over, but we wanted to spend a moment on is, in order to do high quality behavioral health services, you need high quality staff. And so Yvonne just told you some of the tools we use to give our staff. So we've made a huge financial investment in getting tools for school psychologists and now for social workers and other members of the community, to ensure that they have access to high quality mental health tools. So that means evidence-based curriculum for counseling, the best assessments available. But we also spend a great deal of time helping them become highly qualified. One of our strategies we mentioned is having a huge university student training program, which I'll talk about in a minute. We'll talk more about in a minute, where we each year train 50 university students from school psychologist specialist level, as well as doctoral students. And we're the only district in the state where doctoral level school psychologists can get trained and do their internship in a school district. So they're learning how to do mental health work in the school district, rather than learning how to do it in a clinic and then trying to come put their practice to work in a school district. So that university training program is an essential kind of first step in building highly qualified staff, because Yvonne and I get 3 years with a student as they're learning how to become a school psychologist. And when we're ready to hire, we know already who we want because we've helped to train them. So we're getting brand new hires that have already been trained for up to 3 years by us. So that is really a starting block of highly qualified staff, is helping to train the very staff that you want to hire. We also have a great deal of professional development. I think I mentioned it before, but we do over 100 hours of professional development a year just for our school psychologists. So our leadership team comes together with our community partners. And again, this is where community partners step up and help. And we provide high quality PD designed for mental health staff in school. So you won't find that when you go to a lot of school districts around the nation, we find that mental health staff are not supervised by licensed mental health administrators. Often they're supervised by principals or special ed directors. And so they're not always supervised by somebody who can give proper support and clinical feedback and purchase the right materials for them, but they're also not getting high quality PD. So we put a lot of effort, and one of the things we take very seriously, Yvonne and I are flexible people, but don't miss a staff meeting, don't miss PD, because that's really the way that we ensure equitable access to mental health services, is making sure people get high quality PD. We also follow up that high quality PD with professional learning communities. So once a month, we come all together as a staff for PD. We also do every month we do after school PD, but we also have professional learning communities where smaller groups of school psychologists come together in groups of 8 to 12, and they tackle something that we've gone over and learned about. We were lucky enough to have Dr. Samuel Ortiz, a national expert in ELL students. He came and he spoke to us about how to do better, more inclusive evaluations for ELL students. We then, in our professional learning community, say, what did you learn and how are you going to change practice based on that? So it's a really important time for that peer-to-peer work. And then we firmly believe in the importance of professional organizations. So many members of our team are involved in our state association for school psychologists or the social work association. Many of our community partners are involved in state and national organizations. And so together we take all of these different aspects of professional development, professional supervision, and a commitment to professional organizations to ensure our staff are highly qualified by really making a commitment to them being lifelong learners. And so we set goals each year, usually a racial equity and practice kind of goal, as well as a professional practice goal. And we say to our staff, each year we're going to continue, including Yvonne and I, we continue to learn each year, and we make sure our staff know that's important. And so because we have this awesome team that we talked about, they're diverse, they're highly qualified, there's a whole range of initiatives our department has led, and we're hoping that some of these examples resonate with you. We'll be brief so we can make sure, I'm just keeping an eye on time, that we have time for questions, but we can move on, Yvonne, to talk about a few of the initiatives. So yeah, CBHM, do you want to talk about that, Yvonne?
Oh, okay.
Or you want me? Yeah, I can't remember.
Well, we've already mentioned a little bit about CBHM. It's just a bigger framework on how we really want to support schools And I think school psychologists are key players, but also the collaboration with other mental health professionals, right? We can't do this by ourselves. And I think by creating a safe and supportive school model, we really have to collaborate with everyone in the school, right? We can't do this by ourselves. We have expanded the role of the school psychologist, but we depend on the collaboration of everyone at the school level. You know, we talk about family liaisons, we talk about social workers, the district social workers, we talk about even health and wellness, you know, anybody and everybody who works in the school has a positive impact on our kids. And so by collaborating, and this is where it's a comprehensive model, right? Everybody who has anything to do with a student is part of our model, is part of what we do. Increases, the outcomes are that by doing this and by everybody collaborating, it really increases the positive outcomes for the kids. It creates this environment, the school climate, that the kids feel welcomed, the kids feel part of the school, and increases their academic skills because we're working with the teachers, we're working with, you know, everybody, the lunch mothers, we're working with, you know, the secretaries, we're working with the bus monitors, we're working with everyone. And so at the end of the day, it's going to decrease the behavior problems because we have created that safe environment for the students. Did you want to say something about this?
No, I think the next slide is actually a video that gives you a little bit of sense of how we're working with the teachers to build student social emotional skills. So we'll let that speak for itself.
I hear this one. I can't play it, I think.
If you double click on it.
Now, I've been using Grammarly for years. Now, the great thing is Grammarly is free and easy to use. It not only helps you check your grammar, but also ensure that your tone is.
Just click on skip ad. There you go.
Kid comes into the school when they're 4 years old and they leave us when they're 13, 14. I mean, all the stuff that goes on emotionally through all those developmental stages. You can't get through anything if you don't have an emotional connection to the peers that are surrounding you and the adult that's in the room teaching you.
Certainly this school has had a lot of school pride and just kind of this culture of family. What wasn't always available is a comprehensive social emotional learning curriculum.
We kept asking one another, there has to be a better way, there have to be tools. And it was that drive to be better that really brought us to Second Step.
It's been important to me as we shifted our practice from reactive to preventative to really build up a model that I feel I have confidence in. Second Step has provided that to schools and teachers and administrators.
You're deciding consciously. I'm making a decision.
Second Step has empowered me as an educator because it helps me give students the tools for the areas in which they tend to struggle the most.
Entonces, al conocer mejor el programa fue que nos dimos cuenta de que no era algo adicional, sino algo que nos podría ayudar a que los niños pudieran tener un mejor desarrollo socioemocional y a la vez, entonces, al estar así de una forma estable, pueden aprender más fácilmente.
We've tried throughout the years many different programs, and this particular program is the one that is sticking the most.
I love the music of Second Step because it's so pretty and it sounds really good. Ojos mirando, oídos escuchando, boca callada, cuerpos quietos.
I learned that if you're saying something mean to someone, just imagine how that will feel if someone said it to you. And that actually was like, whoa, I was like, whoa, that's true.
By the time we got further into the year, I started seeing kids showing empathy, and somebody got hurt, kids would get up and say, "Are you all right? Are you okay? How can we help you?"
When kids are happy, when kids feel safe, they're able to attend better, focus better, and learn better. And you can just kind of tell when you walk into the classroom, you can tell which teachers are using Second Step every day and embedding it throughout.
because we can have these discussions and because it's something that's embedded in our curriculum, I'm just seeing less kids having to be taken out of the classroom. In fact, it hasn't happened this year in my classroom. I measure success by the way in which our community acknowledges and celebrates every single child. It's about how can we meet them with the needs that they have. We teach math, we have to teach about social emotional growth. Like for me, it's almost like drinking water. It's normal, it's part of what you should be doing.
We need to think about what kind of world we want to build for the students in Boston, the students across the country, across the world, so that we build towards something that we can feel good about and feel like it creates a world that we all want to be a part of.
Sephora at Kohl's is the perfect place to start shopping because you can find a gift set for everybody in your family.
So that is one of our dual language schools, Rafael Hernandez.
Oh, thank you.
Let me see how
that. Yeah, it makes you feel better than hearing from the kids themselves the impact of this work, and though most of them were really telling us that focusing on children's behavioral health matters. And so I'll just say, it sounds great, but if we're not in student outcomes, then we back and check. So we have an intern has BPS staff, hospital staff, university staff, and we really look at our outcomes. And the really exciting thing, and we can look at disaggregated data across years, students, grades, schools, to look at students. And a comprehensive behavioral health model is implemented with fidelity. We see an absolute decrease in social, emotional, and behavioral problems. We see increases in positive behavioral health or positive social skills, and we've been able to maintain time. And the students with the biggest impact are internalizing kids. Those kids with maybe issues developing friendships, perhaps anxiety, depression, trauma history, those kids with internalizing disorders have had the biggest impact. And this picture you see is a picture of a drawing that a student did, saying that his favorite person in the building was the school psychologist because she was there for him. So kids are telling us that works. And I'll just move on, Yvonne, as we kind of continue to get closer to time. One of the really important things we've done, and I'll just give you an overview, but we've created very intensive and systematic partnerships with a range of community partners, and we formed what we call the Boston School-Based Behavioral Health Collaborative, and that collaborative pulls people together, and we have several goals, and one of which is shared training so that a student has equitable access to high quality behavioral health services, irregardless of who provides that service. If you have a social worker, if you have a BPS school psychologist, if you have a community mental health partner, all of them have the same training and the same evidence-based practices. That's our big goal. And we work towards that goal every year by having standing meetings to collaborate on best practices for school-based behavioral health. We have an annual conference where school psychologists, social workers, school counselors, and community mental health partners get trained together on the same evidence-based practices. So for example, one year we were trained on CBHM. Another year, we've been trained on crisis response, on trauma, on recovering from COVID. So we've done this training many years, and it's a way to come together across agencies. As we continue, we show you a couple of specific elements. So the video that you just saw talked about some of our social emotional learning curriculum and work, how are we teaching kids SEL across the universal assessment I've talked to you about, but I'll just say very briefly about 12% to 15% of schools in the nation are now using a universal behavioral health screening. It's one of our key success items. If I leave you with anything today, it's that schools should be doing universal behavioral health screening, not narrow bands graders for suicide, though that is important as well. We need universal behavioral health screening for every child in every school in America. So we're finding kids' needs earlier. That's a component. And then we're using data to drive our decisions. So we're collecting screening, we're collecting other data points like attendance and academic success, behavioral infractions, referrals, and we're saying, how do we need to change what we're doing to meet the needs of kids? And so through all this work, we've seen a variety of challenges and successes, and we like to be very honest about them. We have a video that in the interest of time, I'm going to skip, but it kind of shows you an annual showcase that we do each year that highlights all of this work. We can move on, Yvonne, because I think we have just a few minutes left. But the video, feel free to watch it at another point. It is also on our website, which is shared at the end. And it really shows you how all of these players and partners come together to get this work that we're talking about. But we really want to be honest with you about, you know, how hard this work is. So Yvonne's going to share some curiosidades. I think you're on mute, Yvonne.
Sorry about that. The phone keeps on ringing. Yes. So, you know, who are we? We're the only health service provider in a school district for a psych doctoral training program in the state of Massachusetts. We're the largest school psych training program in New England. We have our own research committee. We have been awarded national recognition by the National Association of School Psychologists. You know, just different things that we have. We have two staff members who've been awarded the Shattuck Award, and Andrea has been one of them. Yay. So we've really worked very hard to provide the students of Boston some really strong mental health supports and some work around special education. We do have, like Andrea was saying, some really good professional learning, and we're not giving that up. I think that's key to our success. We constantly are learning and really working with our partners, not just our community partners, but our internal partners. I think universally training programs is key also to our success, because somebody's got to do this work when we retire, right? And really is teaching our younger psychologists is important. I know we want to have some time for questions, but this is constantly changing. The field is constantly changing, and we have to be also open to what our students are facing. We've got to be changing with our times. And I think as an English learner myself, coming to this country and helping students to really adjust and accommodate and acculturate is critical. As politics change, we also have to take that into consideration to help our families adjust to this changing times, right? So we're really excited about what the future holds, and we really want to continue to support our families and our children. So we're really excited to be here. And I see that the camera has turned on, so I am going to stop and we'll take your questions right now.
Oh, I'm sorry to interrupt.
Yes.
I just want to say thank you so very much to both of you. The main focus of this project is truly to increase access to integrated behavioral health services for youth, specifically culturally and linguistically diverse youth. And you all are doing that in practice. So I just want to say thank you. This was such a wonderful illustration of what this can look like. And as somebody who has spent the majority of my career working in and adjacent to schools, I truly believe that, like, schools to me are the answer to that, right? That is where our young people spend the majority of their time. And so it was just so lovely listening to the two of you share your expertise. So thank you for that. Any questions from the audience? I'm just taking a moment to sort of look at the chat. I actually don't see any. I have One I can certainly jump in with, and we just have a few more minutes. So I also teach a research seminar course, and constantly talking to school counselors in training about the importance of data-based decision making. And I heard the two of you really emphasizing the importance of, of course, our multi-tiered system of supports models, but really using, data and research to guide your work. And you even have a coordinator right at the central office doing that work, which I love that support. I was just wondering if you could say a little bit more about what that looks like. So, what are the folks that are in the schools on the ground? Are they sort of like with, do they have a data sharing partnership with your coordinator? Like, what is that dynamic? How are y'all using data to empower yourselves in this way?
Before we answer that, and I know Andrea can answer that, I do want to say we also do self-care. We take time in every staff meeting to do self-care. This work is hard, and it takes a toll on all of us. And we do take December, we do a big self-care, but every staff meeting, we take some time to do some, whether it's meditation or just some time to really take care of ourselves. And that is critical to our work because we're humans at the end of the day, and working with kids is a lot of fun and it's really rewarding, but it's also very draining. And as mental health professionals, we really have to acknowledge that at the end of the day, we take some of that home, but if we don't take care of ourselves, we are not doing good work. So Andrea, if you want to answer her question.
No, I'm glad, Yvonne. We need 4 more hours with all of you. So please feel free to, stay on. And I did just see a question in the chat. So I'll answer your question and the question in the chat very quickly. Our website is cbhmboston.com, cbhmboston.com. And a lot of resources and more information is there. And if anyone has questions, we welcome you to email us and we'll love to answer them. And I'll start with the question in the chat is, has other districts done this? Yes, we have what we call the JetBlue flight map, and it shows all the places around the world actually that have started to adopt comprehensive behavioral health, from China and Japan to lots of places in the US, from New England states to Hawaii. And so we will talk to anyone who wants to talk to us, because every time we talk to someone, we learn something new. In terms of database decision making, we are very lucky to have an internal to our department research team that is comprised of internal and external staff that can look at the data, that produces an annual report with our outcomes. So please check that out on our website. But really what we do are help schools identify what behavioral health data points exist in their school. And then we ask them all to, we either track them or help support them track them. So things like we had mentioned, attendance, a lot of people already do that. Our universal screening is key to it. Office referrals, if you're in a PBIS system, you're tracking which kids are getting referrals, tracking which kids are getting referrals to counseling, to additional support. And then what we do is take all of these, and we have a process that we call Grow the Green. And so we've created a process in which they can look at that data and take kids from risk zones up to the green, which is no risk zone. And we do that by looking at the data and determining what interventions and supports are needed at the school level, because it really starts with a positive climate, what are needed at the classroom level, and then what do individual kids need. And we do that through a process of reviewing data as a team. And there are different elements of the data.
Thank you so much. I love that. I love the emphasis on the school level intervention and support. So that is so important. And we, unfortunately, as you said, we need a lot more time. I've learned so much from both of you this afternoon, and I just want to thank you again. It is truly, as I said, just an amazing experience listening to you speak about what this can truly look like. So thank you for that. Thank you for your leadership. It's really impressive that so many other folks have adopted this model, and I absolutely see why it's working, and I love it when it works. I spent a lot of my time sharing what didn't work when I was in practice, so it's lovely, and I know it's hard. So I also really appreciate the emphasis on self-care. So thank you. Thank you for being here. Unfortunately, we are out of time, and so we must wrap this up, but I do look forward to future discussion and collaboration. So thank you for all the hard work that you're doing, and I wish you all the very best. Be well, everyone. Thank you all to our attendees for being here as well. Bye-bye. Take care. Thank you.